Hi, I'm Tania Dalton. I'm the chairperson of the Australian Indigenous Psychologists Association. I'm a Gundit Chamara Wathaurong woman, and I'm currently living on Wathaurong country near Torquay in Victoria.
And I'm Kelly Ryan, Aboriginal psychologist. My mob's Cubby Cubby.
I think there's two parts to cultural safety. One is for the practitioner and one is for the individual that you're seeing. So, to my mind, cultural safety is providing an environment where somebody feels safe to disclose their cultural background. And when they do disclose their cultural background, what do you do about it? What is the information that that gives you in them disclosing that they're Aboriginal or Torres Strait Islander? For me, it's around talking about their community and their connections and what resources or supports have they got around them, especially if the person has suicide ideation, and that way you know what you're dealing with straight off the bat. So that's providing a culturally safe environment, non-judgmental, and you also as a worker should know of some cultural mentors yourself in that community. So if you're being told something without breaching confidentiality, you can speak to a cultural mentor and they can give you some advice. Also, it's around getting appropriate professional supervision, which is very different from getting peer support or mentoring from somebody.
True. I think the biggest misunderstanding is that people mistake cultural safety for cultural awareness. Very different. So cultural safety is not just about asking the question, but about knowing what to do when someone answers the question. It's about knowing what your obligations are as a practitioner and as a service provider, and not just for your staff and yourself, but for your client and their community. And knowing what to do, so you're not asking the client for help in responding to them safely. And that requires work and preparation on your behalf. And when they are there, are they treated with respect?
Yeah.
Does your frontline staff know what they're doing, or are they offensive in the way they respond purely because they're unaware or only have the basics? They need to be safe. To be safe, you need to go that step further. And also they need to understand that if the client or the help seeker comes in and they're agitated and they get upset, that it's not personal. It's about being highly anxious around the situation or not knowing whether they're going to be safe.
So a culturally safe environment is providing an environment where there may be symbols that people can see without asking that it's safe to identify as an Aboriginal person. So to have a flag, to have posters, to have the Courier Mail or something like that in the waiting room. So, and also for the reception staff to maybe ask the question and know why they're asking the question. So it's about those cues, and it's about ensuring that confidentiality is kept when people come into your office or clinic or what have you to seek assistance.
For many people who are not accustomed to working with Aboriginal people, it's very important to consider that there are cultural differences. And in working with people from different cultures, we often need to be mindful about the assumptions and expectations that we have about people who are from different cultures to our own. If you're uncertain about how to go forward in working with an Aboriginal family and providing them with the help they need, sometimes it is particularly important that you consider drawing upon the knowledge, the experience of Aboriginal people who may be part of your organisation, to make inquiries about who within your organisation is able to assist from an Aboriginal perspective, and to be drawing upon the assistance that those individuals can provide in working with a family or an individual. In working with Aboriginal families, it's important to consider that Aboriginal Aboriginal people and their families are a very diverse group of people. A common element that is shared by many families, though, is the depth of connectedness across that family. The inclusion of the extended family is an important consideration at any time in working with an individual or their family. And when I talk about the extended family, I'm talking not only about grandparents, but I'm talking about the importance of uncles, aunties, cousins, and kinship relations in many communities that are most important in terms of understanding the significance of family connectedness for the individual who you might be trying to help. For many of us who work in this field, we see our task as being able to assist and to help people in need. It's important, though, if you are one of those people, to be mindful of the cultural differences that exist, and to not apply your own cultural views and expectations and values in working with those people. You have to appreciate the significance of the differences that exist between you as a helper and the individual who you are seeking to help, and to be mindful of those differences in any action that you might take in trying to assist that individual. One of the things that is likely to assist in working with any Aboriginal individual is an approach which involves consultation with others and which draws upon the strength of other people and the community. Working in the field of suicide prevention is a stressful experience for everybody involved, including those who are given the task of helping, and that it is important that you be prepared, that particularly with Aboriginal people you have the sufficient level of cultural competence and understanding to be able to work effectively, but that you bear in mind that at times of stress you really need to draw upon that training to be able to make some headway in terms of addressing the problem. Many services that are out there may not be responsive to the needs of Aboriginal people, that they're not services that are necessarily welcoming or geared up to deal with Aboriginal people walking in off the street and asking for assistance. Sometimes it's a matter of sit down and wait your turn. And for many Aboriginal people, that may well be something that they're feeling that they're being treated differently to others based upon their past experience of having asked for assistance from non-Aboriginal services or service providers and feeling that they've just been misunderstood, that there hasn't been a level of assistance and care provided to them that may have been provided to others. For many Aboriginal people, their experience of prejudice and racism in the past is something which affects their ability to be able to accept and benefit from the assistance and help provided by non-Aboriginal people. It takes time to build trust and relationships with Aboriginal people, and it's important that if you are working and attempting to help an Aboriginal person, that you bear in mind that they are not necessarily comfortable at times in accepting help from non-Aboriginal people.
Debriefing in a family or community context is a bit what we do normally, which is getting together and talking about what just happened and really talking about how you were frightened, how you felt, so feelings about that and behaviours and where that's sitting with you, and really acknowledging how you responded to that in a safe place so that you can release all of that information and tension and anxiety and get some clarity around what just happened and an understanding that you managed to get through that event. That's really important, and that's important culturally and in a community setting and with your family, but it's also really important in a professional setting.
I think when you come in and you deal with somebody that is suicidal and you offer those supports and you do your session, it's very important for you to then debrief afterwards, because you will carry that. It is trauma for you when they come through the door and they're talking about taking their life.
I guess the other thing to add to that is in debriefing, being aware who you're debriefing with, so as not to pass on vicarious trauma. Is the person you're going to debrief with equipped? Do they have an understanding? Are they in a place where they can help, or are they going to be traumatised by what you're about to try and debrief with them. That's really important. To someone when you're practicing Tadiri or you're listening deeply, is you're not listening to try and answer, you're not looking for a fix, you're actually listening. So you listen with the desire to hear, to learn, not to respond, not to fix, just to hear. There's a very big difference in that. So often when you're really listening to someone, deep listening, it gives them the chance to actually talk through what's really hurting them, what the deep sorrow is really about. And in saying that, sometimes it's very helpful for them to hear where that sorrow is coming from. And it's very helpful for you then to be able to help them or work with that.